Upper GI Series by Ashley Kent. Indications and contraindications. Upper GI studies are performed to evaluate the structure and/or motility of the stomach and small intestines. Indications include recurrent unresponsive vomiting, abnormal bowel movements, suspected foreign body or obstruction, chronic weight loss, or persistent abdominal pain. Contraindications include suspected rupture or perforation. If the stomach is filled with ingesta, the study should be delayed. Patients that just had gastric surgery or deep biopsy should not have gastric distension performed, and certain drugs affect transit time by causing gaseous distension or decreasing motility and should be discontinued when performing morphologic studies. Patient preparation. Patients should be fasted for 12 to 24 hours prior to beginning the study. If the GI tract is not empty, it could interfere with the interpretation of transit time, and foreign bodies or small lesions could be obscured. Patients in severe abdominal stress, however, should not be fasted or given an enema or laxative. Give the patient an enema if needed 2 to 4 hours prior to starting the study in order to reduce artifacts caused by gas and to reduce delay of transit time caused by material in the colon. Light sedation can be used if necessary, but keep in mind that sedation or anesthesia can affect the transit time in functional studies. The use of anticholinergics should be suspended for at least 24 hours, but preferably 48 to 72 hours, prior to administering the contrast agent. Survey radiographs should be taken prior to administering the contrast agent to ensure that the study is necessary, that the proper technique is being used, and that the patient is properly prepared. Selecting a contrast agent. Positive and/or negative contrast agents are used to increase the radiographic density difference between anatomic structures to increase the image interpretation. 3 types of contrast agents are used for upper GI studies. Barium sulfate suspension is a positive contrast agent that is most commonly used when a perforation is not suspected. It produces greatly increased radiographic opacity and is inert, non-absorbed, and can be soothing to the GI tract. Water-soluble organic iodides are another positive contrast agent and are used when a perforation is suspected because barium sulfate will not be resorbed if it leaks into a body cavity. Water-soluble organic iodides are hypertonic and should not be used in dehydrated patients. Negative contrast agents include air, carbon dioxide, and nitrous oxide. They're used in combination with barium sulfate for double contrast studies. They absorb small amounts of radiation which produce images of greatly reduced opacity. Carbon dioxide and nitrous oxide are considered safer than room air because they are less likely to cause a serious air embolism due to their increased solubility. Calculating contrast agent doses. For barium sulfate suspension, administer 8 to 10 mL per kg for dogs weighing less than 10 kg and for cats. Give 5 to 8 mL per kg for dogs weighing 10 to 40 kg and give 3 to 5 mL per kg for dogs weighing more than 40 kg. For double contrast or negative contrast studies, when administering air, give 50 to 100 mL for dogs weighing less than 10 kg and for cats. Give 100 to 200 mL for dogs weighing 10 to 40 kg and give 200 to 300 mL for dogs weighing more than 40 kg. Contrast agent administration. Barium sulfate suspension and organic iodides are administered orally with a syringe or with a gastric tube. Towels should be placed around the patient's neck and administration on the X-ray table should be avoided to reduce artifacts from drops of loose contrast agent. A gastric tube is used for negative contrast agents. Patient positioning. Survey radiographs should be taken prior to the administration of a contrast agent and enema. Immediately after administration of the contrast agent, 4 radiographs should be taken: a right lateral view, a ventrodorsal view, a left lateral view, and a dorsoventral view. For each subsequent timed portion of the study, a right lateral view and a ventrodorsal view should be taken. Measurements. The machine I am using bases the technique used upon the weight of the patient and the anatomy being radiographed. The setting for a feline patient who weighs 8.5 pounds for an abdominal radiograph is 80 kVp and 3.2 MAS. When using a positive contrast agent, the slightly higher kVp, an increase of up to 6 to 8 kVp, is generally needed. If the machine settings are not based upon weight, measure at the thickest part of the abdomen at the thoracolumbar junction. Anatomical landmarks. Collimate cranially from T7 for lateral views and T9 for VD and DV views, and caudally to the acetabulum. Labeling. In addition to containing the standard information required on all radiographic images, images in a GI series must include an indicator of timing as well, either time or order taken. Film sequence. Because cats have a more rapid GI transit time than dogs, the film timing is different for the two species. For canine studies, a radiograph should be taken immediately after administering the contrast agent, another one at 15 minutes, then 30 minutes, then 1 hour, then hourly post-administration. And for feline studies, a radiograph should be taken immediately after administration of the contrast agent, then 5 minutes, then 30 minutes, then 1 hour, and then ideally 90 minutes if necessary. The study is considered completed when the barium is in the colon.